Cranberry, specifically in the form of Ellura, is used to reduce the risk of bladder infections, also known as urinary tract infections. It may also help decrease the odor of urine in individuals who experience incontinence. However, it should not be used as the sole treatment for bladder infections, as it may not be effective and could potentially allow the infection to worsen. It's important to note that some herbal and dietary supplement products may contain harmful impurities or additives, so it's essential to consult with a pharmacist about the specific brand you are using. Additionally, the FDA has not evaluated Ellura for safety or effectiveness. It's recommended to consult with a doctor or pharmacist for more information. The typical daily dosage of Ellura is 36 mg, and it is best taken with a meal to ensure optimal absorption. When taking Ellura, it's important to follow the directions on the product package. If you're taking the chewable form, make sure to chew thoroughly before swallowing. If you have any concerns about your condition or experience symptoms of a urinary tract or bladder infection, such as fever or painful urination, it's important to consult with your doctor. They may need to prescribe medication to treat the infection. If you believe you have a serious medical issue, seek medical assistance immediately. If you take very large doses of Ellura, you may experience stomach upset or diarrhea. If these side effects persist or worsen, it's important to inform your doctor or pharmacist right away. Contact your doctor immediately if you experience any serious side effects, such as severe stomach or abdominal pain. While it is rare, a very serious allergic reaction to Ellura can occur. Seek medical help immediately if you notice symptoms such as rash, itching or swelling, especially of the face, tongue, or throat, severe dizziness, or difficulty breathing. It's important to note that this is not a complete list of possible side effects, so if you experience any other effects not listed here, be sure to contact your doctor or pharmacist. In the US, you can call your doctor for medical advice about side effects, or report them to the FDA at 1-800-FDA-1088 or at www.fda.gov/medwatch. In Canada, you can call your doctor for medical advice about side effects, or report them to Health Canada at 1-866-234-2345. Before taking Ellura, it is important to consult with your doctor or pharmacist if you have any allergies or if you have a history of kidney stones. The liquid and chewable forms of Ellura may contain sugar and alcohol, so if you have diabetes, liver disease, or any other condition that requires you to limit these substances in your diet, it's important to talk to your doctor or pharmacist before using this product. If you are planning to have surgery, make sure to inform your doctor or dentist about all the products you are using, including Ellura. If you are pregnant, Ellura should only be used when clearly needed, so make sure to discuss the risks and benefits with your doctor. It is also important to consult your doctor before using Ellura if you are breastfeeding, as it is unknown whether this product passes into breast milk. When taking Ellura, it's important to be aware of potential drug interactions that could affect how your medications work or increase your risk for serious side effects. To minimize the risk of interactions, be sure to keep a list of all the products you use, including prescription/non-prescription drugs and herbal products, and share it with your doctor and pharmacist. It's also crucial to consult with your doctor before starting, stopping, or changing the dosage of any medicines. This will help ensure the safe and effective use of Ellura as part of your overall healthcare regimen. If someone takes too much Ellura and experiences severe symptoms like fainting or difficulty breathing, they should call 911. Otherwise, they should contact a poison control center immediately. In the US, residents can reach their local poison control center at 1-800-222-1222, while Canadian residents can call a provincial poison control center for assistance. Make sure to keep all your medical and lab appointments. It's important to stay on top of your health and follow up with your healthcare provider as needed. This will help ensure that you are getting the most out of your Ellura treatment. If you forget to take a dose of Ellura, take it as soon as you remember. If it's almost time for your next dose, just skip the missed one and take the next one at your regular time. Don't take a double dose to make up for the missed one. Make sure to check the storage information on the package of Ellura. If you have any questions about how to store it, you can ask your pharmacist. It's important to keep all medications and herbal products out of reach of children and pets. When it comes to getting rid of this product, Don't flush it down the toilet or pour it into a drain unless you've been told to do so. Make sure to properly dispose of Ellura when it's expired or you no longer need it. You can consult your pharmacist or local waste disposal company for guidance on how to do this. If you need more help, call your doctor for medical advice. In the US, you call FDA, 1-800-FDA-1088. In Canada, you may call Health Canada, 1-866-234-2345. Wishing you good health. Thanks for watching.